And I met a chiropractor who was doing functional neurology, looking at the neurological response to injury and how that does or does not support and influence the healing process. And then he was using older versions of direct current. So he had this analog device with a bunch of different dials on it. And he treated me, and I saw firsthand how that combination of working with the nervous system and using these specialized electric fields actually helped me heal my ligaments on their own without surgery. I was able to avoid surgery, and I was happy and relieved as a hockey player and as a physics major, as a pre-engineering student, with all those previous experiences in the traditional paradigm.
Welcome back to the DNA of Things. I am your host, Dr. Jeremy Koenig, and today I'm sitting down with a guest whose story begins the way so many of ours begin. They begin with an injury that was supposed to heal. Garrett Salpeter is a college hockey player, a physics and engineering student, the kind of young person who trusted that the right specialist with the right protocol would put him back together. He tore the ligaments in his wrist, was told he needed surgery, and then almost by accident met a clinician who handed him a very different map of the human body. Weeks later, not months, his wrist was whole, and something else had changed too. The physicist in him had seen a pattern the textbooks had shown him. He walked back into the world with a calling. Today, Garrett, the founder of NewFit, the inventor of the NeoBie, and one of the most thoughtful builders I met at the intersection of neuroscience, rehabilitation, and human potential. This conversation is about the operating system beneath the body and what becomes possible when you learn how to read. Garrett Salpeter is a physicist, engineer, and neuroscience trained entrepreneur who founded NewFit after a college hockey injury changed the course of his life. Told he needed surgery for torn ligaments, Garrett instead worked with a doc who used direct current electrical stimulation to heal his nervous system and recovered in weeks instead of months. That experience ignited a calling. What if more people could access this kind of healing? After completing his master's in engineering at the University of Texas at Austin and pursuing graduate level neuroscience, Garrett spent years in clinical practice before developing the NewBie, which is an FDA-cleared pulse-directed current device now used in over 400 clinics by 5,000 plus certified practitioners and approaching 100 professional sports teams and research partners, including the Mayo Clinic, Tufts University, and the U.S. Department of Veterans Affairs. He is the author of the NewFit Method and host of the NewFit Undercurrent podcast. Garrett is based in Austin, Texas, and it is my absolute pleasure, Garrett, to welcome you here today to the DNA of Things.
Thank you, Jeremy. I've enjoyed getting to know you a little bit and really excited for the conversation.
So hockey injury, right? And it's that's the call to adventure was a trauma. And you mentioned, before we started chatting, your connection to fellow Canadians, my fellow Canadians here. I'd love to hear about your journey into hockey and then your journey out of it.
I heard someone describe this framework where to do something that you can really be good at. There's this idea of the hedgehog concept, or different people describe it in different ways. But if you can find the three things that you are most interested in and good enough, someone else might have one or might have two, but it's very rare that someone else would have the same three. If you think about the three things that you're like really most interested in. So I feel really grateful to have found that, because you were talking about my time growing up playing hockey, ended up playing in college. That was a big part of it. Sports was a huge part of my life. That's what motivated me to learn about the human body and physiology, because I honestly wasn't very good. And so I wanted to learn how to get faster and become a better athlete. And that was originally my bridge into learning more about the human body. And then I also had this engineering mindset and interest in physics and engineering, really, really fascinated by that work in school. And then more and more became interested in neuroscience. So I feel very grateful to have found the overlap of these areas. And to your initial question there, Jeremy, about the story. So my origin into this was strongly influenced by the injuries I had throughout my time playing hockey. Growing up in junior high, high school, early in college, I had multiple injuries, and I had the experience with traditional physical therapy, traditional orthopedic medicine, and it was very disappointing, disenfranchising. I, at one point, actually thought about going pre-med, and with those experiences, I just realized, that is not for me. And then my last year in college, I had this experience that was just such a major contrast. It was almost the exact opposite of those previous experiences where I had some torn ligaments, was told I likely would need surgery. And I met a chiropractor who was doing functional neurology, looking at the neurological response to injury and how that does or does not support and influence the healing process. And then he was using older versions of direct current. So he had this analog device with a bunch of different dials on it. And he treated me, and I saw firsthand how that combination of working with the nervous system and using these specialized electric fields actually helped me heal my ligaments on their own without surgery. I was able to avoid surgery, and I was happy and relieved as a hockey player and as a physics major, as a pre-engineering student, with all those previous experiences in the traditional paradigm, to find something that actually made sense scientifically from first principles and had that type of result, that type of effect on me. It was just this amazing, life-changing moment, this amazing epiphany. It felt, had the resonance of almost being like a miracle. And going through that experience, it created within me a calling to want to share that type of work with as many people as I could. And so I still went to engineering graduate school. And when I probably should have been in the lab a little more, I was spending some of that time networking in the sports medicine world. And I met the guy who was the chiropractor for the Texas Longhorns football team. And he had a private practice in town in Austin. I ended up renting a 120 square foot room from him, and using some of these older versions of electrical stimulation, started treating people. I'm, as a non-clinician, but under his license, I also was at that time, that inspired me to go back to additional graduate school in neuroscience as I got more and more into applying neuroscience into the daily practice of physical medicine, rehabilitation, and also fitness and performance. And so I started actually treating people for 8 or 9 years using older versions of electrical stimulation, and just learned more, did a lot of training and certifications with people who had a very, very significant influence on me. And for many years, I was just waiting for someone to come out with something that would sort of take that technology into a modern, scalable, usable, more effective form factor and product. And I figured I would just open up more facilities. And finally, through a whole series of developments and circumstances, I got to the point where I believed that even though I didn't set out to start a medical device company, that really was the next step for me. And I just had to actually create the device. I was in a PhD neuroscience program at the time, focusing on motor control, and had a lot of soul searching, and it was very challenging. And then ended up deciding to leave that in order to launch our product, which is the NewBie for neurobioelectric stimulator. And that was a few-year journey. And now it's been out on the market at the time of this conversation for another 8 years or so.
And then it's one thing to launch it, but then to actually just quickly before we get into the scaling into the 400 plus clinics, what was the injury that you suffered?
It was some torn ligaments in my wrist. So there's all these different 2 rows of 4 bones. I had the scapholunate ligament is the one I remember right now, connecting the scaphoid and lunate bones. And there was one other one. I don't remember exactly which one right now.
And was it just like a cross check, or did you get hit with a puck? Like, how did it happen?
So it was one of those where, you check fellow players into the boards. So I was, a collision where someone was hitting me. We're going for a puck, and they ended up, they're going to hit my body, ended up hitting my arm, and it pushed my wrist into the boards, and it just very forcefully hyperextended it. And, I felt like this electric going through there. It was a really interesting experience. But yeah, then I came off. I was just like, dang, that wrist. Wow.
Yeah. Yeah. I mean, it's tough with the, I suppose the acute injuries or contact injuries, I should say. One of the things I was fascinated with, I share your origin is, the passion for the sport and the performance. And then also the, I suppose the feeling of disappointment, loss, grief, for example, with the injury. And, I was, interested in it from, I suppose, more of a preventative, proactive, route where, what if we could help athletes avoid not necessarily the contact injuries, but the acute or chronic injuries just that comes as a result of their kind of genetic preset? Because there's a lot of, really good science now that would point to indication around the different collagens that we're predisposed to make. So you think of running injury or just, chronic repetitive movement in general. And you think about things like training load, that there is an incredible way to understand the body insofar as its capability and its limitation. As it turns out, even the road back and the road to recovery. And really interested to know more about the process of how that works. Like how does your technology, because it's not just for injury. Actually, I was really quite fascinated by the work that you're doing with chronic disease, with MS research in particular. There, really interested in this notion of the neuroplasticity and the retraining and the recovery using your technology. Can you maybe just break down like what that looks like mechanistically, and then I'd love to learn like how again, that kind of uphill battle of the education into the clinics and the practitioners. So how does the technology work?
It's interesting when you talk about the types of collagen and tissues and structures. That, of course, is important. And where I think we're missing something meaningful in this realm of physical therapy, athletic training, chiropractic, where I think we're missing something is that I think we're sometimes too focused on the tissues and structures and not enough on the function. Too focused, in other words, on the hardware, not as much on the software of the nervous system. And so
Mhm.
what we're really looking to address is the neurological response to injury and trauma. So what do I mean by that? Well, when an athlete sprains their ankle or someone has back spasms, what's happening is there's some initial insult, right? They might twist and roll their ankle and there's some minor tearing or damage to the ligaments on the outside of the ankle. Or someone in the case of a back spasm, someone might collapse in a certain way such that they irritate their nerve root. And then in response to that, body braces and spasms and has this whole inflammatory cascade. There's a lot of times where, yes, as in the case of the ankle injury, there is tissue damage and that needs to heal. And one of the biggest influences that delays or impedes that healing is the neurological response, because in response to that initial injury, the nervous system is going to brace and guard. It's creating tension, trying to lock down that area and limit movement. And in the process, it can create tension that actually limits blood flow and impairs the body's ability to send blood, nutrients, raw materials to rebuild and repair that area. So there's that component to it. There's also inhibition, or the nervous system actively choosing to shut down muscles, again, with an eye towards limiting movement, reducing the amount of force that would be traveling through that area, not wanting to injure it worse. And there is some good in that. And we have protective mechanisms built up naturally that are there for a reason, and we want to honor them. The issue is that they often, because of bad habits and sedentary lifestyles and previous injuries that are not fully rehabilitated, those patterns are often set, or those governors are often set too conservatively, and they limit function beyond what is truly needed for that area to heal and for the body to function optimally. And so what we're doing is actually is scanning around on the body, finding where the nervous system is imposing these patterns. So we have the guarding, we have the, which leads to tightness, we have the inhibition that leads to weakness. There's also hypersensitivity and this perception of threat. One of the biggest themes in the nervous system is threat and safety. So if there's hypersensitivity in that area, because there's more inflammation present, there's an increased nociception, increased sensation of threat or perception of threat in that area. Or if globally the nervous system is on guard and alarmed, it's gonna be more sensitive to those signals. And that's part of why, even after an injury is healed, even after the tissue is healed, people can still continue to have pain because they're still perceiving threat in that area. So there's this whole amalgam of protective patterns that are imposed by the brain and nervous system on the body. And we've found that by addressing those, that not only helps the tissue heal faster and more effectively, but it also helps improve overall outcomes by allowing you to complete the rehabilitation process, by allowing you to restore function so that range of motion is back, strength is back, coordination patterns are back, and you're no longer limited in the same way as people often are. They go back and it doesn't feel quite right again, so they're more susceptible to the next injury. The greatest predictor of injury is a previous injury. And that is because a lot of this really is the missing link. So sometimes it's these really fast breakthroughs in restoring range of motion. Sometimes it's people who have these chronic conditions and you got to work with them to reset and recalibrate some of these patterns over time. But I think that just big picture in terms of the mechanisms, that's really what we're doing, is we're looking to prioritize and emphasize the nervous system and bring into the conversation and bring into day-to-day practice this framework of identifying and then addressing the various neurological protective patterns.
Is there a type of athlete that you see overrepresented in their, let's just say, response to this kind of therapy?
It's, I sometimes half jokingly say that this can help anyone with a nervous system. And that, of course, is overly broad and purposefully a little tongue-in-cheek humorous, but there's different types of scenarios where it can be really effective. One is acute injury, because so many times, that athlete who just sprained or rolled their ankle, or someone who has a, AC separation in their shoulder, whatever it might be, we often see this example where someone has pain and can't put weight on that ankle. Again, just continue with the sprained ankle because we see it a lot and it's fairly common. I can't tell you how many times we've had high school volleyball players or football players come in and they're either on crutches or just limping dramatically. And in 20 minutes of working with the NewFit method, all of a sudden their pain is 50% better. Their gait is normalized. They're either off crutches or just walking normally. And in 20 minutes, their ligaments didn't heal. What happened is we recalibrated that neurological response. So their muscles are firing again properly and working so they can support that injured area as it heals. No, we're not saying go back out and sprint and jump and do everything maximally. But what we are saying is that we're getting rid of some of those impediments that are otherwise slowing down and delaying the healing process. And you think that sprained ankle has to take 4 to 6 weeks. That's because that's what we commonly see when people are not addressing these responses that we're talking about. And we consistently see that 4 to 6 week injury can come down to 1 to 2 weeks when you actually apply this methodology. So there's the acute injury, and then there's post-op surgery, because we just talked about for several minutes the neurological response to injury. Well, guess what? Surgery is a controlled trauma. It's injury, but times 3 or 4 or 5. So the same responses that happen after injury happen after surgery, even more exaggerated. So working with patients after surgery can be huge in helping them get out of pain faster, reduce the need for painkillers, help them reach their functional milestones much faster, restore strength and limb symmetry, all these different things. We see amazing outcomes there. And then there's, as you alluded to, Jeremy, then there's opportunities with individuals who have neurodegenerative conditions and chronic pain and so there's sort of these different categories where some of the frameworks and applications are a little bit different, but there's, the work after an acute injury or after surgery can help a football player just as much as a hockey player, basketball player, tennis player, golfer, etc.
Yeah. Is that where you're seeing the, so like I think about these clinics that you're working with and the practitioners, like at what point of therapeutic intervention are using it? Like to me, actually, I think about, because I've had takedown, and as part of that recovery process, it was like the continuous cooling or the ice machines were a part of the post-op procedure. And, I was on more of like a high performance recovery plan. So you're actually like on the bike like the next day. And is this kind of like how the NewBie is, or one of the points of entry of the NewBie is like, hey, like if you get a surgery, it's like, it's not even a question of whether or not you're doing NewBie. And then, by the way, the reason that I asked about specific kinds of athletes, because I imagine this, and this is just my bias, as like a speed power athlete, right? It's like you get that injury, whether maybe it's not as severe as a labral tear, maybe it's like a hamstring pull. And, the athletes really, they want to get back to play as soon as possible. And, I've always looked at training as, even when it's done well, it's a compensation strategy, right? Like it's, to train speed and power and to say squat 500 pounds or whatever your modality is to, activate the posterior chain, or to train speed of contraction, or, just to run at top speeds, or think about it more asymmetrically, like pole vaulters or canoe paddlers as an example. You've got this strategic adaptation, which is, a compensation, but after an injury, it's like there's a different kind of compensation happening. There's an injury compensation, then there's the compensation that's happening to the stress of the training load. But then all of a sudden, like you're not adapting and you're not compensating the way that you were before, say in the instance of like a hamstring tear. So is this kind of a return to play that basically minimizes the risk of the second injury, because like for correcting for those compensations, let's say?
In terms of the entry point after surgery, we have many clinicians who are using NewFit day one, right after surgery.
Yeah.
And that seems to help a lot because it reduces the more time that one spends in that default pattern after surgery where everything is shut down, the more atrophy there's going to be in the muscles, right? Because there's no signal going to turn muscles on. And so the body wants to conserve energy and resources and tissues because it's metabolically expensive. It takes energy to maintain. And so if it's not using something, it will very quickly break that down so that it can conserve energy. And we see, if not using methods like this, quad muscles after ACL surgery will atrophy to the point where one thigh, the circumference, can be half of the other. I mean, it's dramatic. It looks like you're looking at two totally different people, one leg to the other.
Yeah.
So,
Yeah.
so getting started right away is a big deal, just to the first part of what you were saying there. And then I like the way that you talk about adaptations and compensations. And what really jumps out at me there is the SAID principle, SAID, specific adaptation to imposed demand, where we're always adapting to exactly what we're doing. We're always getting better at doing what we're doing. And that's a neutral statement. I mean, it holds a lot of promise and it's very exciting, but it doesn't necessarily guarantee adaptation in a positive direction. Because if I'm hunched over at my computer in a hunchback position for 8 hours a day, guess what? I'm getting better at being in that position. So when I get up from my desk, I've earned the right to be in that hunched over position. So,
Yeah.
we're always adapting there. And so paying attention to, I mean, you mentioned speed of contraction and rate of force development. So if you're trying to get faster on the field of play and you spend all your time powerlifting, as in just lifting very heavy squats where you're more optimizing for the load, the amount of weight, rather than the speed at which you're moving it, then over time you can actually train yourself to slow down. So that the guys who deadlift and squat 1,000 pounds typically are not the fastest off the line, right? They look a lot different than Olympic sprinters who are optimizing more for speed of contraction. So the adaptation is very specific. And this is where I really look at the adaptation and the strategies here. I look at it like programming a computer, like we're programming software, where we want to train muscles to contract and relax at certain times. We want to train the nervous system to learn to incorporate the right muscles in the right order in different movements. And that's one of the cool things that we find when we actually scan around on the body through what's known as our mapping process. We can find where the nervous system is guarding against or limiting or not using certain areas, or trying to avoid and compensate around certain muscles and tissues. And then we can teach it to start using those areas again. So there's an ability to harness those frameworks of adaptation and neuroplasticity in order to create improvements over time. And you can do them in, with different areas of emphasis and different focus. But I think the base of the pyramid, if we're trying to build performance, I really like this pyramid model, which I didn't come up with, but I certainly will borrow and use, where the foundation is mobility and stability and basically movement skill, being able to move your body through the requisite ranges of motion safely and without pain. And so many times people are limited in their performance and they have injury problems because they're building speed on top of dysfunction. And oftentimes it's a matter of going back to those basics and fundamentals here. And ultimately, when you talk about rehabilitation, one of the biggest issues is that the incomplete rehabilitation. So even if someone gets back to full range of motion, they may not have complete sensory rehabilitations. This is another component of the nervous system where our brains are constantly monitoring input. The brain monitors 1 million or more bits of information every single second coming from inside the body and outside the body. And so proprioception is, even if my eyes are closed, I know my arm is moving, it's overhead or it's out to my side because of the signals coming from my arm to my brain, right? That's called proprioception. Kinesthetic sense is proprioception in motion, in movement. So if it's really interesting, if my brain is getting a signal clearly from my arm, if I just had an injury to this arm and my brain's getting that signal clearly, it knows when I might be at risk of touching something hot or running into something or doing something that might injure my arm again. But if the sensory information is incomplete, if it's not getting that information, it's sort of like the map is blurry. It doesn't really see where that is in space. And so what it's going to do with that lack of sensory information is the brain and nervous system are actually going to limit movement. It's going to make sure we don't move that arm too fast and powerfully because it can't fully predict what's happening and what muscles need to turn on to protect. And it can't sense as clearly if we're at risk of running into something or damaging the limb. So it's actually going to limit movement there and inhibit and shut down. It's not weakness in the sense that the muscles aren't capable. It's weakness in the sense that the brain is actively going to impose some of these limitations, and ultimately comes down again to threat and safety, where the brain perceives that moving that limb could be threatening and dangerous, and so it's going to limit some of the output there. And then if you go to try to override that and throw a baseball or do something, lift a bunch of weight, things are going to be a little bit or a lot off, and you're going to be shifting loads in certain areas, and that's how one injury somewhere, causes you to overload another area and leads to another injury somewhere. And you have these regional interdependencies that cause issues down the chain there. So there are a few components there. I hope I addressed the question, but
oh yeah, no, it's fascinating. And you've actually opened up like a whole, call it can of worms of, that again, it's my kind of speed power bias. And as I'm hearing you describe that, the consequence of those kind of, unchecked or let's say dysfunctional compensations as it relates to, a high performer or high performance movement. I think about the severity of the injury increases exponentially, I suppose, with the speed and the speed of contraction. Right. So you talked about a pitcher, for example, or we talked about sprinters, because there's that risk of having the injury manifest at that maximal point of sport contraction. And so it got me thinking, like, originally I was thinking about NewBie as injury response time or recovery, let's say. And so the question I wanted to ask was like, okay, well, what's the first session of NewBie? So somebody comes in with an injury or post-surgically so what is, and you mentioned mapping, right? So how is it that you're scanning the nervous system? And what's that kind of tell you that, the MRI can't? I think I have a sneaking suspicion of what, but I'm interested to know like how it works. And then also like, is there an application of this like in the wild, right? So like as a pitcher is warming up, or as a sprinter is warming up. I guess my thinking is this something that changes the way high performers are warming up to, not only decrease the risk of injury, but probably perform maximally? Because like you said, there's the paradigm of high performance training has changed so much over time. Like, you used to think that if you're a runner, like let's just say Jesse Owens' training is very different than Usain Bolt's training. It might have been about mileage in the past, where now it's about, okay, well, how many flying 20-meter runs are you going to train? Because really what we're trying to train is top end speed. So there's kind of a two-part question there, but but what's I think critical for me to understand is like how are you actually mapping this? Because to me that's fascinating. It makes me think of kind of like the coach's eye, right? Like I think about coaches like Dan Paff. If he hears say like a triple jumper warming up and they're an A skip or a B skip, like he'll hear that ground strike is off, or he'll see like a QL is tight, and it's like, ooh, that's going to be a good predictor of a hamstring injury later on. So what's my first session like as an injured athlete coming in? And then the second part is, could this be used as a warm up in the future? And the thing that pulls it together is like, how do you build that map, right?
Yeah, for sure. So the first session, mapping is a part of it. I actually often have here by my computer a pad, but I was using it over here. So I'm just going to grab one so I can show you. So if you're listening to this, of course you can't see, but if you're watching, you can see I'm actually taking an electrode that would be connected to this direct current device and scanning around on the body. And we're actually scanning around all the different muscle segments, tissues, areas of the body, structures of the body. And what we're doing is we're sending the same signals that happen neurologically when those tissues are loaded. So we're asking the question, how does this tissue respond to load? How does that tissue respond to load? How about this one? And wherever things are working well, you're going to scan around on that athlete and their body is going to receive that. And it's going to interpret that as, oh, that's within our current capabilities. No big deal. No problem. Then when we go to stimulate other areas that are not working as well, the body is going to receive that input and it's going to say, whoa, that's more than we're used to handling. That's novel. That's different. That's new. That's threatening. And it's going to fight against it. It's going to brace and guard. It'll kind of feel like a trigger point type of reaction, but it actually is this visceral reaction within the body. And what does that tell us? Well, it tells us, let's say we found something. You're talking about Usain Bolt and Jesse Owens and of course sprinters here. Let's say we're scanning around on the legs and we find something on the medial quad, the inner thigh, something like that. That tells us when that athlete goes to run or even walk, they're going to be, even if it's unconsciously, even if it's just a little bit, they're going to be trying to avoid loading that inner portion of the thigh, that tissue there, And so they're going to be a little more on the outside of their leg. So that might mean, for example, when they strike the ground, instead of rolling through to the big toe and really getting that full gait cycle of the leg, they may stay more on the outside. So that's going to change some of their mechanics and impede or reduce their ability to put force to absorb force and create force into the ground and really push off through the big toe for the end of that gait cycle. So then what we would want to do, for example, so that's in the first session, that's what we're doing. We're trying to scan around and find those areas. I like to think, just as a little aside, I like to think of rehab as finding the weak links in the body and bringing them up to match the baseline level of the rest of the system, and then training as increasing the functional capacity of all of those traits or systems of the body. So there's a lot of similarities. That to me is really the difference. But a lot of times good rehab and good training actually look very similar. You can be doing similar movements and exercises, and frameworks can be very, very similar. So a little bit of an aside there. So once we find this, for example, on the medial tissue in the thigh being a hot spot or more reactive, what we then want to do is stimulate that area and have the athlete go through different movements. It could just be simple bodyweight squats or mobilizations. Eventually, we want to work up to the gait cycle and stimulating the gait cycle as well, because we're going to send the signal to the brain and nervous system, teach them that if they before would only allow, just for easy numbers, say 10 pounds of force in that area before the alarm bells go off, and they try to get away from it and load other areas. It's like a hot stove. They try to load, get away, get more to the outside. Then we're going to give them the signal of 11 pounds and 12 pounds and let them work through that and understand that, okay, it is safe to actually allow that amount of force. Then you can turn up the machine and get the equivalent of 13 or 14 pounds of force. And eventually you teach it to understand that it can allow more force on that area without having to fight against it. So instead of building a bigger engine or hitting the throttle on the car harder, you're actually taking your foot off the brake. It's disinhibition. That's part of this first step of finding and bringing up those weak links. So it's a form of exposure therapy. If there is truly injury or damage there, it won't recalibrate and allow you to get past certain levels. But what we're doing is we're feeding that information and presenting the opportunity to adapt. So that's sort of the structure. And the cool thing about that is that very early on, sometimes in the first session or in the first several sessions, you can actually see meaningful functional improvements, sometimes even improvements in strength and performance. And it can be counterintuitive because it's not like we just did a bunch of power cleans and plyometrics, right? So how did the person get faster? Well, they didn't increase the size of the engine. What they did was take off the governors or take their foot off the brake and allow themselves to express the speed that was already in there. They were just blocking themselves from expressing it because their nervous system perceived that it would not be safe to do so. So that's a little bit of what a first rehab session and early stages of rehab can look like. And then to your other point there, Jeremy, about what does this look like in the wild and warming up and stuff like that? Well, you can probably see some of the connections where if you're going out to do a sprint workout and you're going to be loading all these different muscles of the glutes and the quads and the hamstrings and the calves and the core musculature, you can actually stimulate, especially if someone has a little bit of a bias or compensation in certain areas, you can go and stimulate the areas that they're going to need to ramp up and use even more. If they have difficulty again in these areas and you treated them, you can stimulate those areas as part of the warm up, or you can just generally stimulate all the areas they're going to use to get a very time efficient and effective warm up. We have a lot of Major League Baseball pitchers. There's 25 or 26 Major League Baseball teams have the NeoBie and use it in their athletic training rooms. And we hear stories all the time of pitchers will use it before they go out to play. They'll put it on their, typically locations on the arm and shoulder, sometimes the lat, rotator cuff, sometimes it's around the arm. If they have issues with their elbow, they'll put it on and they'll go through some throwing movements. And then they feel like they've just done a 45-minute throwing routine and it's been 3 to 5 minutes because everything is primed and activated. So there's some really cool applications there. And then, of course, there's applications for training, because I like to think of it as sort of digital weight. If we think about training, like you, Jeremy, talked about working up towards a 500-pound squat, and what you're doing there, the reason you lift weight is to use that outside input of the weight as a trigger, as a signal, a stimulus to engage more motor units. The motor units are the nerves that control the muscle fibers. They can control anywhere from 10 to 1,000 muscle fibers, depending on the portion of the part of the body that you're in. And so what we can do is put these pads on the glutes, on the quads, on the hamstrings, and get more motor unit recruitment, even though someone might be doing just air squats with their body weight or very lightweight, you can get as much motor unit activation and recruitment as if you were lifting very heavy, but without, say, that much load of the barbell on the spine. If someone is recovering from a lumbar injury and you want to get that load on the lower body, but don't want to put the spine at risk by squatting or deadlifting heavy, this can be a way to do that. So you can capture some of those benefits of heavy max strength oriented training without as much of the risk of injury or re-injury. So it can make that type of training more accessible, safer, more time efficient, more effective in different scenarios. And you can imagine, of course, other populations for whom, we know how important muscle mass is for aging and longevity, and yet it can be very difficult because of the risk of injury or accessibility to actually lift heavy in certain populations. And so this can be a way to do that as well. So there's these different applications there, and it all comes down to applying the nervous system principles of what are we trying to do? Are we trying to reduce guarding and inhibition? Are we trying to increase recruitment in certain areas? Are we trying to get more contraction in one area and relaxation in another? Like if we're trying to work on hip extension, for example, hip extension range of motion, we can cause contraction in the glute while we simultaneously, with different settings on the machine, preferentially relax and lengthen the musculature on the front, on the anterior side, the hip flexor, quad, adductors, etc. So you can get very precise in what you're doing, and that's where it's specific to the goals and the scenario and the athlete or the human that you have in front of you.
Amazing. We must be in sync or something, because my next question was going to go to like the longevity opportunity here, and referencing back what you'd mentioned before is like, we are optimized for what we've trained for, and there's a lot of like return to play for folks who are maybe in their 40s or maybe even 50s, like, oh, I haven't been paying attention because I've been doing so much work, and then it's like, oh, I want to get back on a strength routine, but it's been years or maybe even a decade, and they've got all this call it atrophy from reduced movement as potentially a demand of their profession. And so, to hop onto something too quick, I mean, you could see yourself getting injured because you've got muscle imbalances. And so I could imagine this is like a great kind of call it screen or intake as part of a longevity plan or program. Because I'll tell you, one of the things that I've kept with me over the years. So I've got background in martial arts like Taekwondo and boxing and swimming and sprinting, and what I've carried forward is honestly the warm up and the cool downs. I'm like, these are the gold, right? Like everything is, those movements are all about the potentiation as opposed to do the work, and it really is. As I've learned over the years and doing a lot of coaching, it is a bit of a movement diagnostic, and not everybody has the luxury or privilege of to do so many sports. And so, I'm often thinking about folks, like how could I help them get to, feeling great in their body, and not necessarily, thinking it's the fitness craze of the week that they have to jump on board. And so there's that kind of general health and longevity application. But then you've also got some pretty interesting stuff, clinically going on here. So work that you've mentioned, I think we spoke before with, Dr. Terry Walls and MS research. And so coming back to that, neuroplasticity, and specifically for somebody who's got a nervous system under siege, and I think that's more of us than we would necessarily like to admit. But I'd love to learn more specifically about the MS use case that you've been tracking through, and and then maybe a bit of a sidebar there in terms of like the psychosomatic element of things, right? Because you put the stims on, and then you've got like an external force telling you, how you feel, or providing that, call it the proprioceptive, and then eventually the kinesthetic application with the new kind of training and feeling in space. So what has that been like for you? And maybe let's just start with the MS, but if there's a bridge there to the psychosomatic pathway, and any thoughts there, I think that'd be really interesting to touch on.
It'll be difficult for me to wait for the psychosomatic because I'm really into that. But yes, we can talk about. So when
We can start with that.
Well, when we can talk about MS, and this is any sort of neurodegenerative condition. These are very, very interesting, and this is something that I've gotten more and more passionate about, in part because I've seen how little the traditional system can do to help these people, how many of these people are left behind, and how many examples I've seen now of people who are, in wheelchairs or need caregivers and really just have lost a lot of quality of life. And we've been able to help them. So we have a case series published on functional recovery in MS patients, a really robust study, randomized controlled trial on neuropathy patients, seeing improvements in function and electrical activity in the nerves. And so this is an area that, although I set out to help athletes like me, giving them the tools and techniques that I wished I had growing up, as this has evolved, I've gotten more and more passionate about that type of work. So with MS, we are talking again about neuropathy, other neurodegenerative conditions, and also recovering from stroke and spinal cord injuries and injuries like that. So neuroplasticity is an adaptation, and the specific adaptation principles that we talked about before are the framework here that we really need to be thinking about. And there's also the dark side of neuroplasticity. Remember, we're always adapting to exactly what we're doing. And so if someone can't move as easily because they have a condition like this and they are more sedentary, their downhill, their decline is going to happen even faster, and they're going to lose even more and more function. It's not fair, but it's the nature of this situation, the nature of this type of disease. And so there's a lot of work that needs to be done just to maintain. And then there's even more that has to be done to attempt to improve function. And neuroplasticity here can be in the brain. It can be triggering the brain to establish new connections and sort of build detours around areas that have been damaged or that have degenerated. In the periphery, that sometimes can happen. You have collateral sprouting of nerves, but oftentimes it's more about attempting to repair or remyelinate, rebuild pathways that have been damaged. So if you think about it's roads that are damaged, you can try to rebuild the road or you can make a detour around it. Those are the types of strategies that happen in successful applications of neuroplasticity for healing. So before we get into that, there's actually one first caveat, which is if someone has a neurodegenerative condition like MS and there's an autoimmune component, first, you have to get under control the immune system and the underlying autonomic condition, underlying autoimmune condition. Autonomic system is relevant, but the autoimmune condition, you have to seal off the area against further damage. Because if we're doing a couple hours of fabulous rehabilitation work every day, but then inflammation from the autoimmune condition is going in and just tearing down whatever connections were made or whatever attempts to rebuild were happening, and it's like you're going in, you're building a new portions of a road or a bridge, and then someone's going in and just taking a wrecking ball and picking apart, breaking up everything you just built. You never accumulate any progress. So that's the first thing. And that's where working with someone like Terry Walls is so valuable. So you mentioned her name, Jeremy. It's WAHLS, Dr. Terry Walls. She's probably best known for her book, The Walls Protocol, and the associated program. She's done a lot of research in MS comparing lifestyle interventions to immune suppressing drugs and found that some of her strategies can be as effective for many people. So really, really fabulous work. So we've done a lot of collaboration with her over the years, and it's been amazing to see. So in terms of neuroplasticity, once you use something like the Walls protocol to seal off against further damage and get that autoimmune condition under control, then we can talk about rebuilding and repairing and these harness the power of neuroplasticity. So what does it take? Well, we already talked about one of the principles where our brains are oriented towards survival and they want to limit, conserve energy, right? They want to limit the force and load for risk of injury. They also want to conserve energy. And one of the biggest issues there is creating enough input to actually tell the body that it is worth investing the energy and resources to build or rebuild these nerve pathways and these muscles, because it takes a lot of energy. It's very metabolically expensive to maintain them. And so it takes a lot of work to actually trigger neuroplasticity to work for good in this scenario. It's like training to be a professional athlete. It's not just a little bit here and there, but it's intense, focused work every day for months and months and months to accumulate progress. And so it can take hundreds of thousands of repetitions of movements to drive neuroplastic change. And of course, you have to have the raw materials. You have to be able to get enough protein in the system to rebuild structures and fat and carbs to have the energy to replenish energy. You have to be sleeping well enough, because that's when most of the repair and rebuilding and replenishing happens. All these different things have to happen. So you have this amount of input that you have to achieve and all these supporting dynamics at play. And if someone tells you, and you're an MS patient, hey, you have to get 300,000 repetitions of, hip flexion here if you want to actually work on that, but you're sitting in a wheelchair and you can't even do one, you start to think, oh my gosh, how the heck I can't even do one. I'm going to get to 300,000. So that's where technology like this, where you can actually use this type of current that mimics the same neurological signals your body sends naturally, stimulating those areas to start to get the input as if you're actually doing the reps, even if you can't physically do it yet. So you can start to build up those pathways and start to accumulate progress towards that goal of 300,000 repetitions. So it starts to build a bridge here towards your destination. And another way that I like to think about it is that, well, so just to summarize that piece of it. So it's sort of like for every, if you have stimulation here that's amplifying the input, it's sort of like, this is not exact, but just to share the principle, it's sort of like for every repetition that you do, you're getting the equivalent of 3 to 5 repetitions worth of input. And it's sort of like if you were going to take a journey from you up in Nova Scotia, Jeremy, to me in Texas, we could do that. We could ride a horse, we could drive a car, or we could take an airplane, right? There's the same amount of distance that has to be covered, just like it's the same amount of work that needs to be done to trigger these processes to happen in the body. There's just a question of how efficiently do we want to do that work? How efficiently do we want to cover that ground? I would typically rather take the airplane if unless I want to take the scenic route for some reason. But most people generally are going to want to take the airplane, take the more efficient path. So that is really how I like to think about neuroplasticity and how we need to approach it. It takes enough input, and then it becomes a question of how do we find strategies to reach that destination, reach that critical threshold faster, and then support it along the way. So neuroplasticity can work in our favor rather than against us. And do we get enough there to transition on the psychosomatic side?
Oh yeah, I think I'm primed for it. I mean, I think that's super helpful. I mean, just even the notion that what I love that you said there was, okay, maybe you can't do 300 reps yet, right? And it made me think of that scene in Kill Bill. I don't know if you remember Uma Thurman. She's like, just wiggle your big toe. You know what I mean? It's like just that first rep, right? And knowing that you've got an assist like that, and that you're plugged in to like what Terry Walls and her work. I think I shared with you at the show, like I watched my mother suffer through the progressive form of MS, and this was decades ago, and these things weren't available. So yeah, very near and dear, close to my heart. So just fascinating that you're doing that work. Thank you for that. And yeah, let's talk about the psychosomatic piece. I saw your eyes light up there, totally unscripted, but it was just like, how could this not have a role to play? Is basically the way my head was thinking about it. Because I'll preface it with this: I had a great coach who I was a walk-on track athlete, okay, and that wasn't necessarily very good. I did the 60 meters, and everybody does the 60 meters, right? So it's like the highest participation because all you do is line up and go. So anyway, I was ranked like 700th in the country, but not very good. After 3 months of working with him, 7th in the country. What happened, right? Like to me, there was like an inhibition thing for me that he helped me unlock, and that's kind of my bias for interest in that aspect of training. But I think there is obviously a bigger issue, like a systemic disease issue potentially here as well. So don't want to put words in your mouth, but really excited to learn your perspectives.
There's so many parts to this. There's the relationship between the mind and the body, which we'll talk about. Before that, I actually just want to share a related comment on how much of a parallel I see between everything we've been talking about here, about how in response to physical injury, the nervous system guards and protects and has these protective and compensatory patterns, how similar, how virtually the same that process is psychologically when we have psychological traumas or pains or ruptures happen to us. We talk about, I'm sure a lot of people listening to this are familiar with the ideas of patterns that we develop, behavioral, psychological patterns that we develop from childhood because we didn't get love. Our caregivers might not have been attuned to our needs. And so we felt like we always needed to put on a happy face or be a people pleaser, or we needed to achieve something in order to be worthy of love and get a sense of belonging. So there's these compensatory behaviors and psychological patterns that we adopt in response to what happens. And those can carry with us just the same as the protective movement-based neurological compensations can stay with us. I just think there's a very interesting parallel there that we can put a pin in for now. And when we talk about the mind and body, to me, there really is no difference, where we know that the brain sends signals down to control the body, right? Tell the muscles what to do and how we move and control the organs of, the heart and digestion, elimination, reproductive organs, the brain and nervous system control all of that. And where I think there's something interesting to be added into the conversation is to understand the influence of the body on the brain. It is a two-way street, absolutely. And there's very interesting research. There's a great overview, a book, I think it's called Spark, Dr. Ratey, Ratey, something like that, where it's a great summary of the research on how exercising and moving the body influences the brain from the standpoint of creating BDNF, for example, which is like fertilizer chemical for the brain that influences the ability relevant to neuroplasticity to create new connections between neurons. It's how we learn. So if you are going to study for a test or you need to learn something, exercising first makes a huge difference in your ability to learn because you have more of these chemicals in your brain. They're going to make you more receptive and able to adapt based on the information that you're learning. You also get other chemicals released that increase the VEGF, for example, vascular endothelial growth factor. So you can build new blood vessels to fuel, to send blood and nutrients to those new structures that are being built, and connective tissues similarly. So there's profound effect there. You also get neurotransmitters and neuromodulators that are released that can have effects by exercising the body. You can have these chemicals released that have effects on the brain that are as significant as things like Xanax or SSRI, antidepressant medications. You can have these anti-anxiety medications. So exercise can have profound effects in that regard. And then there's also this whole notion of proprioception. And I like this thought experiment. Imagine that you wake up tomorrow morning and your brain is coming online for the day and everything's good. So your brain's thinking, okay, we're good. It's kind of taking inventory. And all of a sudden it feels tension in the diaphragm and the abdomen. And it says, oh gosh, there's some tension there. There must be something going on. And all of a sudden it shifts a little bit into hypervigilance and stress mode. Even though nothing bad is happening in one respect, it senses this pattern of tension in the body that, oh, we must be actually bracing or concerned about something. And so it actually adopts that thought pattern, that mind pattern of bracing and concern and hypervigilance. And this can become part of the identity in these deeply rooted patterns. And so releasing, this is part of, this whole field of somatic work, and releasing patterns of tension in the body can actually change that input, that signal that's going up to the brain in a way that influences identity and psychological patterns and the need or the perception of threat and safety and the need to be in a stressed out, hypervigilant, empathetic dominant state. So it is a two-way street. Just the same, one other point of connection, when something is coming at us physically, like you, Jeremy, talking about martial arts, or if a ball or a hockey puck is flying at me, I would reflexively bring my arms up and protect my face and my chest and stuff like that. When something comes at us emotionally, we adopt similar patterns where we kind of flex inward and we have tension in the midline of the body there, diaphragm and abdomen, the chest, pulling in the arms. So we actually, even when something's happened to us psychologically, we adopt those same sort of protective flexion withdrawal type patterns. And working through those can have a dramatic effect on the signals to the brain about how safe or unsafe it is in the body right now and in the external environment. And that can be a huge unlock, because if it's not safe, if the brain isn't safe, it's going to limit performance. That can be energy, right? There's something called the cell danger response. When there's a lot of inflammation, for example, inflammation in the system, the body interprets that as, oh my gosh, we must be fighting an illness. It could be a food sensitivity, right? It could be from someone having too much alcohol. It could be an environmental toxin. But if there's inflammation in the system, the initial interpretation is we must be fighting an illness. There's a pathogen here, so that's why there's inflammation. And so we need to conserve energy. And so inflammation is a signal to actually shut down or reduce energy in muscles and in the brain, because we can conserve the movement energy and we can conserve higher level cognitive function, save that for later, because we need to put that energy towards fighting this immediate pathogen and this disease. So there's these types of things happening in the body all the time. And those patterns in the body are profound signals that influence those processes of energy and threat and safety and really identity and beliefs and behaviors. So it's a two-way street. And when we scan around in the body, I think sometimes we're also finding the patterns of tension that are bracing, not necessarily always in response to physical injury, but sometimes in response to psychological stress and that type of perceived threat or challenge or stress or so I think there's a lot of overlap, and working through those patterns that are, if the nervous system is guarding in response to a psychological stress, you can work through that pattern in the same way as you would when you're working through a pattern in response to a physical injury or threat.
Amazing. Do you see like this, like a consumer application for what you're building, and, not now, or haven't thought about it yet as a completely okay answer, but like I'm thinking about, there's like, what's it called? Like the neuroplasticity training. Is that what it is? They have those glasses, the Muse glasses. And so it's kind of like a brain retraining tool. You see like a lot of these like naturopathic doc clinics have these, but there's a consumer version where it's, basically trying to light up different regions of the brain, but it's a consumer app. So it's subclinical, preclinical. I guess what I'm getting at is, do you see like a preclinical application for what you're doing?
And the one you're talking about, is that like a VR thing, or is that something about shining lights at the eyes to trigger activity in the brain? Or
I want to say like it's it's bioneurofeedback is what I was thinking. It's not bioneurofeedback. Yeah. Um, but in the way that they have like kind of like a clinical version, there's a lot of folks who like struggle. Like I know practitioners that do this with kids with autism or ADHD, for example. But there's consumer versions that are more to kind of handle or manage stress. So as I say, kind of preclinical. So is there a preclinical future for, any of the applications that you're working on? Not that you don't have enough to do already, but just interested to know if that's on your roadmap.
yeah, definitely. It's a great topic, and it definitely is. And what I think about here is a concept that I've learned and heard Gray Cook talk about. So if you don't know Gray Cook, he's along with his partner Lee Burton, the developer of the FMS, functional movement screen, and then their company of the same acronym FMS is functional movement systems. They do the
Mhm.
SFMA. They've trained over 100,000 clinicians in movement assessment and screening, and brilliant guy. I've actually been very blessed to get to know him and explore collaboration opportunities. It's fun. They say don't meet your heroes, but this is one example where the hero turned out to be a great guy, and I'm so glad I've gotten to know him and explore these collaboration opportunities. So he actually talks a lot about this notion of movement readiness. We have our Whoop or Aura ring that tells us our autonomic nervous system readiness and energy and metabolic state, and that's awesome. And there's also an analogous concept of what's our movement readiness, how supple and adaptable are our muscles and tissues that day. Is this a day where we can go and run or lift heavy with minimal risk of injury, or is this a day where it's a ticking time bomb and we're going to go? And sometimes that correlates a lot with the HRV and the sleep score, sometimes not. So there is this notion of movement readiness, and I think we're heading towards a time very soon where we'll be able to, everyone on their phone will be able to do a couple movements, and the phone will be able to tell us how well we're moving that day. Maybe it'll be able to take measurements of tissue pliability. You can actually, there's these cool tests where you can tap muscles and see how relaxed they are based on how they absorb the little tap and the pliability of the tissue. Because if you're less recovered, the tissues are going to be stiffer. It actually takes ET to not to contract, but to relax between individual contractions. So a more supple muscle and tissue actually has more energy, a little bit counterintuitive. That's why when a person dies, their body goes into rigor mortis and it stiffens because it doesn't have the energy to break between the muscle fiber contractions and connections there. So I think we're fast approaching a time where we'll be able to have our own movement readiness score, and then that'll give us a customized recommendation for, hey, we want to be a part of this. Hopefully it is the NewBie, more consumer version or something like that down the road where people even use the one we have now in their homes, something smaller, different price point, of course, even more accessible. I think it's based on that. We can say, okay, if you're going to work out today, you're going to do this, you do this, this, and this, and that will help your movement readiness score just the same as you can do recovery techniques or different things to help your Whoop and Aura and other types of readiness scores.
Yeah. I love the reference to the supple. Makes me think of Kelly Starrett's supple leopard. Yeah. Yeah. Yeah, that's, and it's different, right? Like I think about how your technology would work and what it would facilitate, like compared to what's it called? The Normatec, for example, right? That seems to be like more of like, I mean, it's it's not like these are non-overlapping magisteria. I mean, there are, regions where, there's a confluence, between metabolic flushing versus injury and tonality. But yeah, I can see the readiness suppleness is something that, I mean, just so much application. This is a bit of a tangent, but because I know we're close to time. I mean, I wish we booked so much more time. But I think of it as, I remember seeing this like infomercial. This was years ago. It was on like Tai Chi, right? And there were like the customers or the models. I mean, they were like 70 plus, 80, but like you could see it, like you could see that suppleness, that like tone and the flow of their movement. And it wasn't just like in the Tai Chi exercises they were doing. It was like the way that and they weren't even advertising this, but just the way I noticed they would walk downstairs or just turn around. Like there's an elegance and a flow to it. Like I think of like a ballerina and like tensegrity, like there's a grace of movement that, unless you're training it specifically and you have somebody, again, in the world of ballet, like really reinforcing it, with that coach's eye, it's really hard to get there. So yeah, I imagine like what it could feel like to get to that, state of, as you said, suppleness and, having a training partner to do that in the home. Like it's quite exciting possibility. And I know the FMS folks as well. So that's amazing. But hey, honoring your schedule and in mine, I just wanted to, say, so thank you so much for joining. But just quickly before we sign off, one thing that I always ask my guest is who should be part of this conversation, or could you recommend somebody as my next guest on the DNA of things?
So I guess two names that I've mentioned during this conversation: the Dr. Ratey, the guy who wrote Spark. I guess I don't even know if I don't know how old he is, if he's alive, if he's still practicing. I don't even know. But talking about the effects of bodily exercise on the brain. Gray Cook, I mentioned. One other person who comes to mind is a physical therapist named Lisa Chase, who was the physical therapist, the lead physical therapist on the women's tennis professional tour for many years. And she also, even though she's a physical therapist, she's the co-chair of the osteopathic manual manipulation curriculum at Michigan State University. And she now has a private practice in St. Petersburg, Florida. And she wrote a book, brilliant physical therapist. And she wrote a book on a holistic, my description here, I hope I do it justice, a holistic approach to physical therapy, looking at how a lot of these underlying things, like you talked about, Jeremy, connective tissue and collagen and things like that. She's looking at how inflammation and other issues in the body influence the healing process of tissues, and how physical therapy is not just stretching and movement, but how sleep and stress and the autonomic nervous system, how all that plays in. So she has a fabulous book, brilliant physical therapist. So she's actually the one who probably comes to mind.
Amazing. Well, let me say, Garrett, it's just been absolutely fascinating chatting with you, like from all the way, from the inception into the mission and to the growth and scale that you've been able to facilitate. I just wanted to say, and not only thank you for joining me today, but thank you for everything you've done, you are doing, and that you will do. It's been an absolute pleasure having you.
Well, thank you. Hey, coming from you, Jeremy, that means something. I really appreciate it. And thank you, everybody, for tuning in.
There is a line Garrett returned to near the end of our conversation that I can't shake. He said, "We are always adapting to exactly what we're doing," which means the nervous system is not just the seat of our injuries. It's a place where our futures are being written, one repetition, one perception of threat, one act of courage at a time. What Garrett has built with NewFit is, in its deepest sense, a tool for exposure, for teaching a cautious body that it is safe to move again, safe to feel again, safe to become again. That is not a story about a device. That is a story about what it means to carry your biology with you and still choose who you become. If this episode moved you, please send it to the athlete in your life who is still on the bench, or the parent navigating a neurological diagnosis, the friend whose body has become smaller than their spirit. Tell them the operating system is more plastic than they were taught. And while you're at it, keep asking that beautiful question this conversation pointed toward. What would become possible if we learned to take our foot off the brake before we built a bigger engine. Until next time, I'm Dr. Jeremy Koenig, and this has been DNA of Things.